Okay, go ahead.
Welcome to Group 7's presentation of the U.S. Department of Health and Human Services. My name is Reagan, and I'm joined by Sarah and Tracy. So to get started, what is the U.S. Department of Health and Human Services, or HHS? It is a cabinet-level department of the federal government. Its mission is to enhance and protect the health and well-being of all Americans. They fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. Moving on, in addition, so we have some strategic goals of the HHS. Their plan for the years 2014 to 2018 describes the department's efforts within these four broad strategic goals. The first being to strengthen healthcare, 2, advance scientific knowledge and innovation, 3, advance the health, safety, and well-being of the American people, and 4, ensure efficiency, transparency, accountability, and effectiveness of the HHS programs. And in addition to these, we have, sorry, you can go to the next slide. So we have, in addition to this, that there are 11 agencies and offices under the direction of the HHS. This is kind of an organizational chart to give a good overview, and much of which will be covered more in depth as we go on. So moving on to the next slide, we have some of the administrations, beginning with the Administration for Children and Family, or ACF. They work to create and support economic and social well-being of families, children, individuals, and communities through educational and supportive programs and working with states, tribes, and other communities. They not only work on a national level to create and support economic and social well-being for children and families, but they also work with states, tribes, and other community organizations to ensure that they're meeting the needs of children and families. We also have the Administration for Community Living. They work to support older Americans and those with disabilities to have greater access to the resources that are available to them. It was created around the fundamental principle that older adults and people with disabilities of all ages should be able to live where they choose, with the people they choose, and with the ability to participate fully in their communities. On the next slide, we have the Agency for Healthcare Research and Quality. They work to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable. And they work within the HHS and with other partners to make sure that the evidence is understood and used. They kind of bridge the gap between research and medical practice by keeping patients safe and helping doctors and nurses improve quality. And they also develop data to track changes in the healthcare system. Then we also have the Agency for Toxic Substances and Disease Registry. They work to prevent exposure to toxic substances, the adverse health effects and diminished quality of life associated with exposure to hazardous substances. Kind of similarly, on the next slide we have the CDC. Most of us are pretty familiar with it. The CDC works 24/7 to keep America safe from health, safety, and security threats, both foreign and domestic. Whether diseases start at home or abroad, or chronic or acute, curable or preventable, human error, deliberate attack, the CDC fights disease and supports communities and citizens to do the same. Little fun fact for you, the CDC was one of the first health and human services agencies to implement the tobacco-free campus policy. Just a little bit more about the CDC. On the next, we have the CDC's pledge to the American people. There are 24 federal advisory committees that provide advice and recommendations on a broad range of public health issues to help the agency achieve its mission to promote health and quality of life by preventing and controlling disease, injury, and disability. Next, we have the Centers for Medicare and Medicaid Services, or CMS. As we know, Medicare is the federal health insurance program for those who are 65 and older, and certain young people with disabilities and those with end-stage renal disease or permanent kidney failure. Medicaid is the state and federal program that provides health coverage if you have a very low income. We also have the FDA. They are a part of the Public Health Service, and they have the responsibility for regulating the manufacturing, marketing, and distribution of tobacco products. They have the responsibility for advancing the public health by helping to speed innovations that make medical products more effective, safer, and more affordable. And also, they play a significant role in the nation's counterterrorism capability. The FDA fulfills this responsibility by ensuring the security of the food supply and supporting this development of medical products to respond to deliberate and naturally emerging public health threats. Then we also have Health Resources and Services Administration on the next slide, which is programs that help those in need of high quality primary care, like those living with HIV or AIDS, pregnant women and mothers. They also support the training of health professionals, the distribution of providers to areas where they're needed most, and improvements in healthcare delivery. They oversee organ and bone marrow and blood donation. So they have a really important role in the healthcare system. We also have IHS, or the Indian Health Services. They're the provision of health services to members of federally recognized tribes that grew out of special government-to-government relationship between the federal government and the Indian tribes. So it's specifically programs that help the Indian tribes help them to meet their health needs. So the last two we have are the National Institutes of Health, and they support biomedical and behavioral research within the United States and abroad. They provide leadership and direction to programs designed to improve the health of the nation by conducting and supporting research in the causes, diagnoses, prevention, and cure of human diseases. They have many different ways in which they provide the leadership. Some also include they support research in the understanding of mental, addictive, and physical disorders, and also in the biological effects of environmental contaminants, and the list just goes on. We also have, lastly, the Substance Abuse and Mental Health Services Administration. So they work to improve access and reduce barriers to high quality, effective programs and services for individuals who suffer from or are at risk for addictive and mental disorders. They lead the public health efforts to advance the behavioral health system of the nation, and their mission is to reduce the impact of substance abuse and mental illness on the American communities.
Okay, so now moving on, we have the personality or the principal players of the Health and Human Services. And let me just pull up the slide. Okay, so starting off, we have Thomas E. Price. He is the Health and Human Services Office of the Secretary, and his advocacy focuses on 6 key principles of affordability, accessibility, quality, choices, innovation, and responsiveness. And he was sworn in on February 10th, 2017. And he works to advance the quality of healthcare in the country, both as a physician and a policymaker. And along with him is the Deputy Executive Secretary to the department, and that is Wilma M. Robinson. Next, thank you. And next we have the Office of the secretary, and this is a list of all 14 offices, and right now we're just gonna go over the Office of Inspector General that has a setup similar to all of these offices, but this is the one that we specifically chose to focus on. So on the next slide is the Office of Inspector General, and they are the largest Inspector General's office in the entire federal government, and they are dedicated to fighting against any type of fraud, waste, and abuse in the federal government. So what they do is they conduct audits, investigations, and evaluations, as well as assist in the development of cases of criminal, civil, and administrative enforcement. So next is the 6 components within the Office of Inspector General. And those are, first, the immediate Office of Inspector General. The second is Office of Audit Services. Third is Office of Evaluations and Inspections. Fourth is Office of Management and Policy. Fifth, Office of Investigations. And sixth, Office of Counsel to the Inspector General. So the next slide is, we're just going to go through each of those 6 components. So first of all is the immediate Officer of Inspector General, and she's responsible for the fulfillment of the Office of Inspector General's mission, as well as promoting efficiency and quality in management and processes. And Christy Grimm is the Chief of Staff. And the second component is the Office of Audit Services. And what they do is they conduct audits of the Health and Human Service programs to just basically examine performance of the different programs, just making sure they carry out their responsibilities, they provide assessments, and that is Gloria L. Jarman, who is the Deputy Inspector General for Audit Services. Third, we have the Office of Evaluations and Inspections, and what they do is they conduct evaluations of Health and Human Services programs from a broader perspective. So they focus on preventing fraud, waste, abuse, as well as encourage efficiency and effectiveness in the programs. And Sue Marin is the Deputy Inspector General for Evaluations and Inspections. Fourth, we have the Office of Management and Policy. And what they do is they provide support to the Office of Inspector General, as well as they ensure that all the needed resources. And that is Robert Owens, who is the Deputy Inspector General of Management and Policy. Fifth is the Office of Investigations, and what they do is they conduct criminal, civil, and administrative investigations of fraud and misconduct related to the Health and Human Services. And Gary Cantrell is the Deputy Inspector General for Investigations. And sixth, we have the Office of Counsel to the Inspector General. And what they do is they provide legal advocacy and counsel to the Inspector General and other Office of Inspector General components. And that is Gregory E. Demsk, who is the Chief Counsel to the Inspector General.
All right, so the other offices that are part of the this entire Department of Health and Human Services include the Office of the Secretary for Administration, which is the ASA, the Assistant Secretary for Financial Resources, which is the ASFR, and then the Office of Secretary of Health, which is OASH, and then we continue on with the Assistant Secretary for Legislation, the Assistant Secretary for Planning and Evaluation, the Assistant Secretary for Preparedness and Response. Those are some of them, and then on to the other side of the slide, there is the Assistant Secretary for Public Affairs. There's the Civil Rights, or the Office of Civil Rights. Then we have the Department of Appeals Board, the Office of General Counsel, the Office of Global Affairs, the Inspector General, which we just went over, the Medicare Hearings and Appeals, and we also have the Office of National Coordination for Health Information Technology. I'm going to kind of go over some of those. They're all on the website with lots and lots of information available to them. All right, so the Office of Assistant Secretary for Financial Resources, this office oversees the office, has the budget. They have the Office of the Budget, the Office of Finance, the Office of Guidance and Acquisitions, Policy and Accountability. They also review the health benefits and income support programs. They also work with program management and system policy. They work to to make sure the programs have integrity, just to kind of name a few of the things that they do in their sources. The Office of the Assistant Secretary for Health, they are the leaders that are dedicated to developing policy recommendations as they pertain to public health issues that pertain to the HHS agencies and operating divisions. They oversee the 10 regional offices throughout the nation, or the 10 regions, not just offices, but they also have the Office of Communication and let's see what else. Yeah, Office of Communications is in there. So they really work with the Assistant Secretary for Health as well, and the Surgeon General is included in this office. The Office for Assistant Secretary for Planning and Evaluation is responsible for the disability, aging, and long-term care policies. They have several divisions amongst these offices, which include the health policy, human services policy, science and data policies, but they also have disability, long-term care, behavioral health and intellectual disabilities, health policies, and public health, healthcare access and coverage. They cover so many things, including the economic support for family, children and youth, as well as technical analysis of the information, and also the Office of Science and Data Policies. So they really do work on quite a few different things in this particular office. The next office that we wanted to work on, or to point out to you, is the Office of the Assistant Secretary for Preparedness and Response. This office is responsible for taking care of the Biomedical Research and Development Authority, emergency management, acquisitions, contracts, and grants. So this is where you get government grants regarding to health policy, as well as policy planning, financial planning and analysis, and they also have an Office of Chief Operating Officer in there. Let's see. Our next one is the Office for Civil Rights. We felt like this is one that you guys needed to hear about because they house the offices for General Counsel and the Chief of Staff and multiple directors and deputies, and the regional managers over the Director of Civil Rights, the Deputy Director of Health Information Privacy, the Principal Deputy Director and Senior Policy Advisors, the Deputy Director of Operations and Resources, and they include several different regions which are different than the other 10 regions that we discussed earlier. These ones have names instead of 1 through 10. These ones are New England, Eastern, the Caribbean, Mid-Atlantic, Southeast, Midwest, Southwest, Rocky Mountain, and Pacific regions. So those are the civil rights offices. We also have an Office of Global Affairs. And this is the President's Emergency Plan for AIDS relief, where the Office of Pandemics and Emerging Threats is. Also, they deal with policy, agency coordination, and multilateral affairs, as well as each region of the global community. They really work for program coordination and making sure that everything, the international relations are going well. Then we move on to the Office of Medicare Hearings and Appeals. This office is where if you have a Medicare or Medicaid appeal that you need to make, this is where it goes through. They have the Chief Administrative Law Judge, and they have 6 field offices all around the United States, and yeah, they have quite a few things going on there. Then we have the Office of National Coordination for Health Information Technology. This one is very interesting because this one is responsible for making sure that they set policy for all of our health information, and this is where the I can't remember, I didn't put it in my notes. The HIPAA basically came through this office. They have the Officer of Chief Privacy Officer, Chief Operating Officer, Chief Scientist is here, Standards and Technology, Clinical Quality and Safety, different programs, planning and evaluation analysis, and they also have a Public Affairs Office. The Office of oh, I already went that. Where did I miss? I missed one. So each of these offices that we have talked about, there are quite a few more, but we decided not to go through every single one of them, but they are listed previously And I hope that we've been able to give you guys some good information about the Department in Health and Human Services. And our last slide is our sources.
All right, great work. Sorry if I didn't do a great job of advancing those slides, but I think we're good. Yeah, great work. So what I typically ask each student after we're done with the presentation is, what was the most interesting thing that you learned as you were studying this topic? So we'll start with Reagan, and then I'll ask each of you the same question. So Reagan, go ahead.
Hopefully I'm not stealing the answer of everyone else, but I think the most interesting thing about studying about this is just how intricate it is. Just how much, how many offices there are, how many administrations, and each have such an important role. I kind of focus more on the administration, so I really like to learn about how each of these administrations are working together to help improve our healthcare system and ensure that the things that we eat, or the medical, like the medicine or the medical products we're using, are all safe. And yeah, it was really interesting to kind of learn more about that.
Great. All right, Sarah, same question.
Me, Sarah?
Yep. Sarah, yep.
Well, I would say the most interesting thing was probably that I learned to appreciate the health and human services a little bit more, because like Reagan was saying, they really have agencies for everything. They have it for families, they have it for elderly, they have it for, low-income people. It's I don't know, it made me appreciate how much they take care of people in every aspect of life, whether it's mental health or children or Indian health, or it's just so broad. But I don't know. That's what I thought.
Great. All right, Tracy, same thing.
What I got from it, well, it was really interesting, is I did not realize that the U.S. Department of Health and Human Services was a cabinet level department, because I always thought that the Administration for Children and Families, I thought it was its own entity, and I thought that the CMS was its own entity, and the FDA was its own entity. I had no idea that they all fell under this one umbrella. And so to me, that was really fascinating to see that, okay, there is an umbrella that monitors and takes care of all of these things. And then those offices there are 14 different offices, and those 14 offices take care of all the legal and the community or the public affairs, and they all just kind of work together with these agencies to make sure that everything is being taken care of, because the umbrella started with the U.S. Department of Health and Human Services, yet it just kind of goes down, and those offices take care of the agencies. And that was really what I found was very interesting as we were researching and studying this, is how it was set up, because I honestly had always thought that all of those other agencies, I knew they were government agencies, but I thought the FDA stood all on its own. I didn't realize that it came underneath the umbrella of the U.S. Department of Health and Human Services.
Awesome. Well, great. That was a huge topic for you guys to cover, but you did a great job of covering it. So I'm going to go ahead and stop recording, but hang on the line.